Hello, I'm Dr. Sean Reed, and I'm an associate professor in the Department of Family Medicine at the University of Virginia School of Medicine. Thank you for watching this segment on UVA's Mini Med School special podcast on COVID-19 Charlottesville. It's my pleasure to introduce our guest today, Ms. Jennifer Freeland. Ms. Freeland is the Volunteer State Coordinator in the Office of Emergency Response, which is a part of our Virginia Department of Health. Jennifer, thank you so much for joining us this morning. We really appreciate it. We know you must be extremely busy, and we appreciate you taking the time to be with our viewers.
Yeah, thank you for the opportunity.
You're very welcome. So I think the obvious is that the pandemic has had an extraordinary effect on our communities and all across the globe. It's affected our schools, our entertainment, our sports and recreation, but there's been enormous coverage in terms of the strain that it's had on the health systems, and we've certainly felt that here in the Commonwealth. I'm wondering if you can, today we'd like to sort of highlight for our viewers the ongoing program the Virginia Department of Health has that allows some volunteers to step up and participate, because we've certainly heard some amazing stories about the work that people are doing already. Could you give our viewers kind of a brief overview of the Volunteer Corps and its mission?
Sure. So our Virginia Medical Reserve Corps volunteers are a dedicated workforce who stand ready to support the community in an event of a public health emergency. Our 22 units are comprised of teams of both medical and public health professionals and community members who volunteer their skills, expertise, and time to support ongoing public health initiatives and assist us during events like this COVID-19 response. Combined, we have over 17,200 approved volunteers, and over 7,558 are licensed healthcare professionals who have a medical background. The UVA community is a part of our Northwest MRC unit. And within that group that serves the Thomas Jefferson Health District, we have 887 approved volunteers. Wow. And since the end of February, when Dr. Oliver made his call for healthcare professionals to join the MRC and be a part of our COVID-19 response, we've had over 300 community members join our MRC unit. So that's a wonderful response, and we continue to receive many applications every day since the call out from the governor to onboard over 30,000 volunteers. We have approved over 8,500 new members in our Medical Reserve Corps. So for us, that was almost an emergency into itself, having to manage such a large number of community members that have joined us. Of those, 7,550 of them are licensed healthcare professionals, practicing retired medical students from all walks of life. Some individuals actually have licenses from other countries. So we try to find a place for everyone. But I think maybe bringing back some history to this conversation is that we at one time had a UVA MRC unit, and it was the first student-led MRC unit in the nation. During H1N1 pandemic response, we needed to use volunteers to support mass vaccination efforts, and the student leadership at the time was not available to support volunteer management for that response, so we had to transition the unit back into the health department. We really hope that this conversation and the COVID-19 response will perhaps reignite the interest in the MRC unit, again, within the UVA family in Charlottesville area.
Wow, it's an amazing response. That's just incredible. Can you share some of your thoughts about, why should people volunteer? What's the real benefit to the Commonwealth and perhaps to them of volunteering?
Sure. I think first and probably personally, it's the ability to give back to the community and help others. It's what really drives us. I think especially individuals that have felt a calling to become a healthcare professional. You care about the health of your community. And this is a way to, I think, not only respond to the results of needing medical surge, but also in the part of what we do in public health is to prevent medical surge. And so it gives you the picture of looking at professionally the overall broader public health response. That we have our front lines that happen at VDH, which start long before hopefully a patient ever ends up in receiving care, that we're tracking the response and we're doing our very important outbreak investigations and monitoring and surveillance. So there's there is a lot involved with partnerships and planning and coordination. And this is an opportunity to kind of get a behind the scenes perspective on that, and get out of the patient care, the direct care box of what healthcare is in a facility, and see what it's really like in the community. I can say that, obviously our governor has called for 30,000 volunteers. At the time, we were looking at our alternate care site planning, so having to step up and create hospital-like settings in convention halls and mock-up tents outside of hospitals and the such. And thankfully, due to our wonderful efforts of all of our citizens in the Commonwealth, we've been able to flatten the curve and haven't had a need as much for that medical surge. But what we're seeing right now is we do have kind of peaks and outbreaks definitely in our long-term care facilities. And that is a challenge for us. It's a challenge for us because the workforce is now shifting as we start to provide more care. And we haven't, we're now able to do more elective surgeries and see more patients in different ways. The healthcare providers that were available because nothing was going on are now going back to work. And so we have this kind of coconut shuffling of, I like to say, of workforce. They were here, now they're gone, now they're over here. And, I know at a time, a lot of higher education, everybody was still taking classes online, and now we've kind of got where we're doing graduations and some people are going home and they have a break. So this is a great opportunity while you have a break from your academic life to be able to get invested in your community. And we really need that additional support in our long-term care facilities providing medical care. And I'll explain maybe a little later and give you a good picture of all the different volunteer activities we're doing around the state today.
Yeah, that'd be great. That'd be great. Boy, your coconut shuffling certainly resonates with me. A lot of my colleagues, we've had to really kind of rework where we're applying our skill sets and so forth. And the idea of expanding your context of what COVID is and the pandemic response by volunteering, I think, hopefully is resonating with a lot of our viewers, assuming that they are, and I'm imagining many are interested in trying to help out and to volunteer. Can you explain a little bit about what that sort of process would look like in terms of being able to register for the Corps?
Sure. The registration process is very simple. We have an online website. We can show you some of those pictures now. You go to our website and there's a button at the right-hand top of the screen that says Become a Volunteer. You can go there and then you click through the application process. The application, you have all of your materials in front of you, your licenses, your driver's license, your CPR certifications, and all of your credentials. It usually takes maybe 10 to 15 minutes to complete it. And once you complete the application, create your account, it's like similar, or I think we're all used to registering for something at some point in time. Right. It's pretty simple and self-explanatory. And then once you're approved, you're contacted by your MRC unit coordinator. And then we actually right now have an online orientation process. And we do background investigations. Then depending upon your qualifications, we put you on, in your interests, we put you on response teams. And when those teams are needed, we notify you of the different deployments that we have, and you can indicate whether or not you're available or not available to respond. Okay. I know that this area is transient, I would say, according to the season and whether or not perhaps school is in or not, there's variations of where people live. And what we ask that people do right now is that you sign up to volunteer where you are and where you're living currently, so you can serve your community. When your community changes and perhaps you come back to Seville, we can transfer you back to the Northwest MRC Unit Coordinator, and you'll be led by the MRC Unit Coordinator there. His name is Chris Rainey. So what we hope is, if you want to come on and be a short-term volunteer and support us just for this COVID response, we welcome you. We hope that you find it rewarding enough that it becomes your lifetime volunteer, part of your life as a volunteer. And, life changes. We have kids, we get a job, there's no requirement for us that you volunteer X amount of hours. It's that you stay connected, you stay engaged, and when you're available, you volunteer. So just want to make that, because that really is part of the application process, and probably one of the most frequent questions we get is, where should I volunteer, and can you transfer me? But we do move people around the state, which is great too, because it gives you a perspective of what public health is like in this community. And if you live in Richmond, then you're getting a perspective of what public health is like in Richmond. And public health in Bristol, Virginia is very different than public health in Charlottesville. So, even beyond just the broader picture of public health, it's the community picture of public health. And there's a lot of, I'm sure, population health and social determinants of health, and there's so many things that impact our communities. So I think it's a really great learning opportunity.
Sounds fantastic. So you've mentioned, it sounds like there's a lot of different ways to get involved, and you've mentioned that, there are areas like long-term care facilities where there's a lot of needs and so forth. So could you sort of paint a picture of what some of the volunteers are doing today, and so our viewers get an idea of some of the things they might be asked to do?
Sure. So as you know, one of our big initiatives is to ramp up testing. And we are doing a lot of testing out in the community. We call it point of testing, community testing. So in some areas, we're literally setting up tables and, and tents and parking lots, and people are walking up. In other areas, they're doing drive-through testing. We have had many partnerships with a lot of organizations and programs and universities that have come alongside us and have become MRC volunteers, and they've done testing. And whether or not that's helping with specimen collection or packing up materials or setting up, I mean, even if you just started out, we take 18 and older. So there are a lot of, as you know, logistical aspects of running a clinic out in a parking lot. So we had volunteers doing that.
Doesn't sound easy.
Yeah, no. And we have contact tracing. So we have had volunteers doing contact tracing and supporting our epidemiologists since the very beginning. I know it's what's hot in the news right now, because it's a focus, but it is a core public health function that we do every day. We actually have a hepatitis outbreak in the southwestern part of the state right now. So we're still doing daily public health, even though COVID is going on. So those functions still have to occur. And we need that additional support to be able to do that. We are looking at a very, I think, a lot of the volunteers that are Medical Reserve Corps volunteers, I think Dr. Remley, our previous health commissioner, who is the kind of leading the testing effort right now, during H1N1, she called them our public health champions. We have volunteers that are willing, that come a part of VDH and become family. I think that's what's really cool, is once you become a part of our VDH family, you can't really leave. We've had so many people come back. I was surprised.
That's nice to hear.
Yeah, I was doing a volunteer orientation. I looked, and it's the previous state health commissioner and a health director on the orientation. So we have a great team, but we really do need those ambassadors. So in order to kind of contain, we also want to do infection prevention. So they have asked that we have infection prevention ambassadors at polling locations for the May 19th elections, and probably we'll be doing the same thing in November. So we'll be putting volunteers in each of the polling locations, and they'll be making sure that people stay 6 feet apart, that they're wearing a mask, that they're not, we're doing as much as we can to prevent infection. So we do PPE fit testing. So we have volunteers that are fit testers that go out and do that. And then, as I mentioned today, we have volunteers that are admirably driving across the Chesapeake Bay Bridge Tunnel, all the way from Hampton Roads and Chesapeake, Virginia Beach, and Newport News, and are going up to our Northampton County. There is a long-term care facility there that has critical staffing with COVID positive patients and COVID negative areas. And we have volunteers that are doing some incredibly important, compassionate work to be able to help that facility and take care of those patients. And I think that just really speaks to the heart of a volunteer. My quote is, never underestimate the willingness of a volunteer. I certainly never would have thought that, one, we'd be deploying volunteers into long-term care facilities and they'd be driving an hour to an hour and a half to go do that. And I just think that is truly a representation of the wonderful people that we have as a part of our team.
Wow, agreed. Gosh, Ms. Freeland, thank you. This is wonderful. I think this is a different view, right? This is our public health community coming together and respond to the pandemic, which, as you and I have talked about before, I don't know that everybody sees that side of the response. And so thank you very, very much for spending the time with us this morning to share what the Corps is doing and all the people that are involved. And certainly, please extend our gratitude to the hundreds of your colleagues that are helping keep our community safe all across the Commonwealth. And we really, really appreciate it. Thank you so much for your time.
Thank you for this opportunity. I look forward to seeing a lot of new volunteers apply and see maybe their pictures on our Facebook page. We try to share what we do. So you want to stay in touch, definitely follow us.
That'd be great. That'd be great. And for our Mini-Med segment watchers, please stay tuned for a final message from our team. Hello. This is the final segment in our UVA Mini-Med School special podcast on COVID-19 Charlottesville. It's been our privilege to help provide this up-close examination of our community's response to the COVID pandemic. I hope that we've answered some of your questions along the way and that we've provided some new insights into the astonishing activities that are still ongoing. Finding the right path to take on a new and uncertain landscape is just not easy. We've been introduced to the concept of flattening the curve and social distancing as a way to try and reduce the loss of human life related to the COVID-19 virus. We've also experienced and witnessed the extraordinary economic hardships that many in our community are experiencing as a result of these protective measures. Finding the correct balance between these economic and health concerns is not easy. There's real suffering on both sides of the equation. My hope for our community and our country is that we'll continue to work together to help navigate these exceptional times. I want to thank each of you for doing your best to help ensure that we succeed in our endeavor. Thank you and be safe.
Hi, I'm Shriram, Sundararaman, and I'm a fourth-year medical student here at UVA. I've always looked forward to taking part in Mini-Med School, where I've been able to teach and learn from enthusiastic members of the Charlottesville community. In fact, Mini-Med was the creative inspiration for this podcast in an effort to bring practical medical knowledge straight from UVA physicians to our community. Given that there's so much that's still unknown about coronavirus, this is understandably a very hectic time, filled with a lot of uncertainty and anxiety. As medical students, we felt that it was even more important to learn about how UVA Health and our community has been impacted by the virus and make this information available to you all. Through this project, we've also come to appreciate how our community has sort of rallied together in this time of need. Whether it's our researchers that are developing testing kits or contributing to vaccine development, our essential workers on the front lines that are maintaining our hospitals, roads, grocery stores, school teachers that are hosting virtual classrooms, and even those of us that are forced to stay at home, we all have made real sacrifices to keep our most vulnerable population safe. We hope that you've been able to appreciate this for yourself by listening to all the speakers in our podcast. And on behalf of all the medical students that were involved in the making of this project, thank you so much for your time, and please stay safe.